I see that you made an appointment today for a foot, knee, and leg examination. So what's going on? What happened?
Yeah, so the bones in both of my legs have been hurting recently, and my left knee feels like someone's touching it when no one's actually touching it.
Okay. Left knee, phantom sensations occur. And when does this happen? All the time? Sometimes when you're doing a certain activity?
It's honestly random. I don't think it's attached to any specific activity.
Okay. And are just your knees impacted? How about your legs and your feet?
I really just feel it on my knee.
Okay. And when did this begin?
A couple weeks ago.
Have you taken up any new activity, any lifestyle changes?
I have started running a little bit more.
And do you use proper running shoes?
Yes.
Good. Any other symptoms I should be aware of?
I think that's it.
Okay. So no other symptoms. Do you have any pain associated with these sensations?
Well, the bones that are hurting, but that's not really connected to my knee, so.
So the bones are hurting too?
Yeah.
Okay. When did that pain begin in your bones?
I think a week before my knee.
A week before the knee. Okay. On a scale of 1 to 10, how intense is the pain?
About a 6.
6 out of 10. Okay. Do you have any headaches? Any hearing abnormalities, tinnitus, any blurred vision or double vision?
No.
Okay, so eyes, ears, not impacted. Okay. And that phantom sensation of somebody touching you, is it all around? Is it mostly localized in one place? Where is it happening?
It's more in the bottom part of my knee, but it is over the whole thing.
More on the bottom. Okay. Interesting. Are you on any new medication?
No.
No new medication. Okay. And how often would you say you're running?
A couple times a week.
Do you have any difficulty breathing while you're running?
No.
Okay, interesting. This video is sponsored by Dossier, a company that sells premium quality, ethical, affordable perfume for all. Say yes to smelling good and no to overpaying. I recently got a couple more perfumes from Dossier because I love them so much. I tried out the Aquatic Lime, inspired by Armani's Acqua di Gio, which retails for $79. This masculine smell features a splash of freshwater fruits, marine notes, and zesty lime, followed by sharpened and delicately assembled woodsy and moss notes. Dossier only charges $29 right now, a fraction of the cost for the same exact smell. I also tried the spicy vanilla inspired by Tom Ford's Noir, which retails for $122. This is a true head-turning fragrance that any man will appreciate. It opens with a burst of hot spices led by nutmeg and black pepper, warm and mysterious. Spicy vanilla evokes a sense of raw, sensual masculinity. You will make an impression while wearing this perfume, I guarantee it. Dossier also sent me the Woody Ginger, inspired by Tom Ford's Tom Ford for Men. This is an earthy, yet full of vibrance fragrance which opens with a fizzy ginger and pepper duet, progressively softening with violet and orange blossoms. Tom Ford charges, listen to this, $84. Why not get it from Dossier for only $29? The same exact smell, a fraction of the price. I also love the woodsy basil inspired by YSL's Loam, which retails for $89. The fragrance is a fresh garden smell, an uplifting and crisp combination of basil and ginger with a hidden hint of violet. You can't go wrong with this unmistakable masculine smell. Just head over to their website, dossier.co, and check out the sales currently going on. Click on the link in the description down below and use code LUNALUX10 at checkout for 10% off. You will get premium products at incredibly affordable prices. So let's go ahead and just visually inspect your knee. If you can kind of cross your legs a little bit and bring this one up. I'm gonna go ahead and put on some gloves and we'll do a physical assessment first, and then I'm going to do a neurological assessment, and then I'll focus on the legs and your feet. Do you feel that sensation right now?
It's very slight.
So let me go ahead and just visually inspect your knee first. Skin appears normal. There are no blues or grays, no redness. I'm gonna go ahead and palpate for any inflammation of the knee tendons and the patella in the front. I'm not able to feel any indentations around your kneecap. I'm gonna go ahead and tap on the patella. Let me know if you feel any pain. Okay. And I'm going to go ahead and check your sensitivity to cold first. Do you feel this?
Yes.
Good. And this?
Yes.
And this?
Yes.
And sensitivity to vibration. Feel this?
Yes.
And this?
Yes. Yes.
Good. I'm gonna take a couple of measurements. 7, 16, 17, 2, 2.5. So good ratios. I'm going to check the symmetry. Seeing a little bit of an asymmetry here. There's a slight shift towards the right side in your tendon here.
Let's do a sensation test. Keep your eyes closed and tell me if you feel sharp or dull. Dull. Good. Sharp. Okay. Sharp. Good. Dull. 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 Sharp. 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 Okay, good. Okay, good. You can now put on your feet here. Okay. I'm going to take a couple of notes. Dermatome examination was negative, no positive findings. So skin sensations were good. I just noted a slight leftward orientation of your patella and kneecap, which is a little bit misaligned. I'm gonna make a note of that. We'll keep an eye on it. Alright, next up I'm going to go ahead and check the dermatomes in the rest of your body on your chest, your arms, and your upper part of the legs right here, and your face, and do a more in-depth neurological examination to see if there's anything going on with the nerves, the cranial nerves. Have you noticed any of those sensations anywhere else on the body? No? No. Okay, so go ahead and keep your eyes closed. I'm going to touch you again with a sharp or dull object. Just say sharp or dull. Sharp. Okay. Sharp. Good. Dull. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Wonderful. So upper body dermatomes, no positive findings. I'm going to focus on your face as well. Sharp. Dull. Dull. Sharp. Dull. Good. Sharp. Dull. 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 Sharp. Dull. Sharp. Good. Okay, next up I'm going to tap on the bony prominences of your upper body, and I'm checking for any sharp shooting pain, any abnormal neurological responses. Okay, I'm gonna start with the top of your head. Wonderful. And let's check your reflexes. You can just leave this arm loose. Okay, 1, 2, 3. Okay, 1, 2. Good. And the other one. Good. Okay.
So I'm not able to find anything abnormal with the dermatomes on the upper side of your body. Okay. I'm going to quickly check the temperature of your upper body as well. Seeing some changes in temperature throughout the body and very obvious gradients of temperature can be a sign of neurological disorders. So I'm not able to note any changes in temperature gradient throughout your body, which is a very good positive finding. Okay, can you give me a big wide smile? Okay, good. And now frown. Good. Can you lower your eyebrows like that? Good. And raise them up. Perfect. So good mobility, the cranial nerves controlling the movements of your face. I'm going to attempt to push you back. Don't let me do that. Resist. Good. Now I'm going to attempt to bring you forward. Perfect. And I'm going to attempt to rotate your body. Good. Perfect. Okay, so I think I'm satisfied with the upper body examination. Not able to note any positive findings or anything abnormal with the cranial nerves. Okay. Let's go ahead and lay down, face up first, so I can take a closer look at your knee, legs, and feet. Checking for any skin indentations, any hidden lumps. And for signs of edema. Checking the superficial skin response. Okay, no neurological damage is noted.
Can you flex your right foot all the way to your chest? Any pain there? Good. And the left one as well. Legs, any pain there?
No.
Good. Alright. I'm gonna go ahead and take a couple of measurements. Of the skin here. Checking the level of fat tissue as well as the skin response. Okay, it's normal. Good. 12. And here was 12. Good. Is it okay if I remove your socks?
Yeah.
Going to check the skin first after the reactive substance was placed. Checking in between the toes. Good. Capillary refills. I'm seeing a slight delay in capillary refills. It's almost 3.5 to 4 seconds, which explains why your feet are also so cold. Lower body circulation is not optimal. Very cold feet and getting warmer towards the knees. I'm gonna check the pedal pulse. Okay, 2 plus. Good. Okay, I'm going to check the integrity of the phalanges bones. Good. And the metatarsal. Excellent. And can you wiggle your toes in this position? Okay. Can you attempt to bring your big toes towards your head? Good. And you can lower now. Okay. Can you push into my palms? Good. And I'm going to attempt to spread your legs apart. Don't let me do that. Resist. Good. Alright. Okay. Let's check toe symmetry. 20, 20,
ratios. Okay, I'm going to check the dermatomes on the upper side of your feet. And I'm going to touch with something that applies pressure to say yes when you feel it.
Yes. 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 Yes.
Okay, and now I want you to say now when you stop feeling this sensation.
No.
Good. Okay, do you feel this?
Yeah.
And this?
Yes. Yes.
Good.
Yes.
Okay. Now I want you to say now when you stop feeling it.
No. 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 No.
Good. Is this sharp or dull?
Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. 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 Dull.
Okay. Okay, you can turn face down now so I can take a look at the plantar region of your feet as well as your calf muscles in the back. Okay, I'm gonna go ahead and check for edema first in your calf muscles. And palpate the plantar region. I'm seeing a symmetric buildup of callus. Is this painful at all?
No.
Plantar region is not painful. I'm gonna go ahead and take a couple of measurements and check for symmetry and any inflammation. 21, 20, 5, 5.5, 8, 7, 9, 8, 7. Checking for any indentations on the skin.
Do you feel that?
Yes. 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 Yes.
Good. Let's check the symmetry of the calcaneus region. 42, 41, 45, 45. Good symmetry. Okay, is this sharp or no?
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp.
And can you wiggle your toes here? Okay, good. And now can you curl your toes around my finger? Perfect. And release. Good. And curl your toes around my finger. Perfect. Release. Good. Okay. Now I have here a hot and a cold object. I'm going to touch you with one at a time. Go ahead and say hot or cold.
Hot.
Good.
Cold.
Good.
Hot.
Good.
Cold.
Good.
Cold. Hot.
Good.
Cold. Cold. Hot.
Okay, a little bit of mixing of sensations of hot and cold. So from a neurological point of view, we need to keep an eye on the dermatomes in your calves and plantar region. Okay, you feel this?
Yes.
Now I want you to tell me when you stop feeling this.
No. No. No.
Okay, good. Let's try that one more time.
No.
Good.
No.
Good. Was that sensation continuous?
Yes. No.
Good.
No.
Good. Good neurological reflex here. Okay, you can go ahead and stand up so we can discuss the findings. Okay, Brooke, so this completes the assessment for today. I did a very thorough neurological assessment of the dermatomes in your upper body, your face, your lower limbs as well, and your arms. There was a little bit of a mixing of hot and cold sensation on the back of your legs as well as on the plantar region of your feet. So I want us to monitor that symptom. The knees were physiologically okay. I'm not seeing anything that we need to further follow up on, but I also want to monitor the sensation that you mentioned you're feeling in your right knee.
So I'd like to see you back in about a month and reassess.
Okay.
Do you have any questions for me today? Okay, then I'll see you again soon.
Okay, thank you.
Welcome back, Amber.
Nice to see you.
Good to see you as well. So I understand that you have a problem with your knee, leg, and foot. So what happened?
Well, I'm a gymnast and I was on the bar, the high bar, and I slammed my foot into the lower bar.
Okay, left or right?
My left foot.
Your left foot.
Yeah, and it has like a bruise on it, so my big toe is in a bandage.
Okay. When did this happen?
About a week ago.
A week ago. And did you hurt only your foot or
I
anything
just
else?
hurt my foot, but sometimes I get like weird feelings.
Weird feelings.
Like sometimes it feels like on my feet that I'm wearing socks when I'm not wearing socks.
Really?
Yeah, like it's kind of fuzzy, and then there's like tingly sensations. They start on my foot and they go up my leg.
I see. And how about your knee?
It goes up there as well.
Okay. So you feel like you're wearing socks when you're not. Any tingly sensations, any numbness?
Yes.
In your foot, your leg, knee, or all three?
My foot gets numb, but my knees just get tingly.
Do you have any pain?
In my feet, but not my knees.
Okay. Any numbness of feeling like you're touching certain areas of the skin and you can't really feel that touch?
Sometimes on the bottom of my foot and on my kneecaps.
On your kneecaps? Interesting. Okay. And did you do anything right after you had the accident? Any hot, cold presses? Any medication?
I took some over-the-counter painkillers.
Okay.
And I also put ice on it, but I didn't do a hot pack.
Okay. Are you allergic to anything?
I don't believe so.
I'm not seeing any discoloration on the skin, no bruises. But I'm going to go ahead and do a very thorough medical examination of your knee, leg, and foot. I don't like the fact that you're feeling phantom sensations. That can sometimes be an indication of something neurological happening, nerve damage. So I do want to investigate that a little bit more in depth. Do you feel anything else that stayed on your mind because it's just so unusual?
No.
Okay. Any burning sensations?
I don't think so.
Okay. How about anywhere else on your chest, arms, fingers, face?
It's just in my legs.
Just so lower extremities are mostly impacted. And how bad was the accident?
It was pretty bad.
Pretty bad. Did you lose consciousness when you fell?
No, it just it hurt to walk for a few days. Because I slammed it real hard.
Okay. All right. So let me go ahead by taking your vital signs first. I'll put on my gloves, take your vital signs, and then we'll focus on the cranial nerves and your knee and your legs.
All right.
All right. Alright, do you mind lifting up the leg a little bit just so that I can take a better look at the knee? Okay. I got my night right here. Do you feel me touching you right now?
Yes.
Okay, so you feel the tapping sensation. Okay. I'm gonna go ahead and palpate. And I'm going to check the patella and the kneecap. And down the tibia bone. Do you feel this?
Yes.
That's a good sign. Okay. Gonna go ahead and take some measurements and check the symmetry. So I'm not seeing any inflammation. That is obvious. Do you have any pain right now in your knee?
No. It's actually hard to feel a little bit, the part that's on my kneecap.
Okay. Right there?
Yes.
Do you feel this?
A little bit. I feel it when you're further down, but not like right here.
Okay. How about this? Do you feel that?
Yes.
And this?
Not really.
And this?
A little bit.
Do you feel that?
A little bit. On my left.
Okay. How about here? Do you feel this?
Yes.
Alright, let's do a test that's called sharp or dull. So this is very sharp. Let me know if you feel it. Okay. And this is dull. Do you feel that?
Yes.
And how about here?
Yes.
Okay, and this?
Sharp.
Okay.
Dull. 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 Sharp.
Okay.
Dull. Dull. Sharp. Dull.
Now I'm going to check the sensitivity to vibration. So just keep your eyes closed and tell me if you feel this.
Yes.
Okay.
Yes. A little bit.
A little bit only. Okay, let's try a more intense one. Did
A
you feel
little
that?
more. I think a little bit.
And right on the patella. Do you feel this?
Not really, no.
Interesting. Okay, let's try something that places an equal amount of pressure on the patella. Do you feel that?
No.
No. Okay. How about that?
Like a little bit. A little bit there as well. No. Yes. Yes. A little bit. A little bit as well. Yes.
Okay. Do you have any pain there?
No. 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 No.
Okay. And I have here an object that is cold and one that is hot. Continue keeping your eyes closed and just say hot or cold? Hot. Okay, that one is correct. Cold. That's correct. Hot. Okay. Cold. Okay. Hot. Okay. Cold. Hot. Cold. 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 Okay. 6, 6, 7.2, 5.2, and 9, 8, and 8.5, 10, 4.2. Okay. I'm just checking the proportions. Okay, so we did have a little bit of mixing of the sensations, hot and cold, and you have some loss of sensation in the patella here. The bones are intact. Your tibia bone is just fine. Sharp and dull, and vibration sensitivity is intact. Right, let me go ahead and take your vital signs, and then I'm going to have you lay down, and I'll take a more in-depth look at your legs and your plantar region of your feet. Okay, let me just go ahead and take the temperature first. Have you had any flu-like symptoms in the last 2 weeks?
No.
Okay. Just gonna go over the forehead and behind the ear. 98.4, so do not have a fever. And let's check the levels of oxygenation. Okay, I can just place this right here and just relax your hand. And I'm gonna go ahead and listen to your heart and lungs. Okay. Just breathe normally. A little bit of an elevated heart rate. Good. Okay, 98% oxygenation and about 105 for your heart beat. Take a deep breath in and out. In. I'm looking for any hissing sounds, any murmurs. Lungs are clear. Good. Alright, let's have you lay down and take a closer look to your legs and feet. Okay, Amber, is it okay if I remove your socks?
Yes.
And I see the left foot that is bandaged up. Going to do just visual inspection first. Not noting any bruising, no abnormal colors. Skin response to UV light is normal. No micro lesions are present. Going to palpate your legs and check for any signs of edema. Actually, I'm going to check the temperature first, since I am noticing that you are a little bit too cold on this foot. Yeah, definitely. Not so much this one. Your right foot is much more cold than the left one. Okay, I'm going to check your pedal pulse. 2 plus, synchronized. Good. No signs of edema are noted. Okay, I'm going to inspect in between your toes. Going to check the popliteal pulse too. Good. Let's test the dermatomes on the front region of your legs and your feet. And we're going to do the same sharp or dull test that we did on your knees. So can you tell me if this is sharp or dull?
Dull.
Okay, good.
Sharp. Sharp.
Okay.
Dull. Dull. Sharp. Sharp.
Right.
Dull. Dull. Sharp. Sharp. Dull. Sharp.
Okay. very good. Now, can you wiggle your toes? Good. And while I press down on your left foot, can you slightly lift your left arm? Okay, good. Now I'm going to press down on your right foot. Can you lift the left arm? Okay, good. Perfect. Now can you lift both of them? Okay, you have strong back muscles. Can you push into my arms with your feet? Good. Can you wiggle this toe? Okay. And can you wiggle the one that's bandaged? Okay, good. Can you tell me which toe I'm touching you?
My pinky toe.
Okay. And how about now?
My big toe.
Okay. And how about now?
My big toe.
Good. And how about now?
My fourth toe.
1, 2, 3, 4. That's right. Okay. I'm going to spray some water on one of your legs. Can you tell me if it's the left or the right one?
Left.
Okay.
Right. Right.
Good.
Left.
Good. Let's test the sensitivity to vibration. Just say yes if you feel a vibration.
Yes.
Okay.
Yes. Yes.
And do you feel this?
Yes.
Okay. Just say now when you stop feeling the sensation.
Now. 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 Now.
Good. Okay, your ankles are not swollen. I'm gonna go ahead and tap on the bones, especially the phalanges, and I want you to let me know if you feel any pain.
That hurts a little.
This hurts a little here.
Mm-hmm.
Okay. Did you feel that?
Yes.
How about that?
Yes.
Okay. And is this sharp or dull?
Dull.
How about this?
Sharp.
Okay. I'm not noting any nail clubbing or pitting. And capillary refills within 2 seconds, so good blood circulation. The phalanges are intact, ankles are not swollen, dermatomes are all right. Okay, let's go ahead and flip face down so I can take a look at the plantar region of your feet. Can you wiggle your toes? That's good. Going to do the Babinski test. So if you can leave all your weight into my hand here. Okay, that's negative Babinski on the left foot. And to negative Babinski on the right one. Eight. 7 across the calcaneus region. And 7. Okay. Do you feel any pain here?
No.
And how about there?
No. No. No.
Okay. Can you curl your fingers, your toes around my finger? Good. And now release. And curl your toes again around my finger. Good. I'm going to test your sensitivity to vibration. So just say yes when you feel the vibration.
Yes. Yes.
Good.
Yes. Yes.
Good. And now I want you to tell me if you feel this.
Yes.
And this.
Yes.
And now just say now when you stop feeling that feeling.
Yes. No. No. No.
Any loss of sensation?
No. No.
Okay. That's good. Now we're going to do the same hot or cold test that we did earlier on the plantar region of your feet. So go ahead and say hot or cold.
Hot. Cold. Cold. Hot. Cold. Hot. Hot. Cold. Hot.
Okay. You feel this?
Yes.
And this?
Yes.
And I'm going to spray you on one of your feet. I want you to say left or right.
Left. 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 Right. 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 Right.
Okay. Do you feel that?
Yes.
Okay.
Yes. Yes.
Alright, next up I'm going to perform some acupressure therapy to stimulate the nerve endings in the plantar region of your leg and increase circulation, promote health, relaxation. gonna go ahead and put your socks back in your feet. I think I didn't put this on too well, so I'm gonna just redo it. There we go. Okay, Amber, so I did a very thorough medical assessment of your knee, your legs, and your feet. You did mix a couple of the hot and cold tests that we did, so I want to monitor you for potential nerve damage. I'd like to see you back in about a month, and until then, try to not put too much pressure on your foot. Try to rest up as much as you can. Don't wear high heels if you're in the habit of doing that.
Just a little bit.
Just a little bit. Maybe just try to avoid just until we get to the bottom of what's going on with your nerves. Do you have any questions for me today?
No.
Okay, great seeing you.
It's good to see you.